Assalamualaikum and good day everyone. My name is SAIYIDAH from UKM. Will present the poster entitled The Prevalence of Multiple Myeloma in Malaysia by Cytogenetics. So multiple myeloma is the formation of the abnormal plasma cell that occur in bone marrow, resulting in cytogenetic abnormalities. A normal B cell would develop into plasma cell that produce antibody to fight antigen. However, abnormal B cell develop into abnormal plasma cell, also known as myeloma cells, that produce monoclonal protein, also known as M protein. Multiple myeloma would cause anemia, bone pain, kidney problems, and excessive bleeding. If it's not treated, then it can lead to death. The cytogenetic abnormalities involved in MM can be categorized into structural and numerical abnormalities. So it can be detected using cytogenetic tests such as karyotyping and FISH, fluorescent in situ hybridization. Then cytogenetic analysis also helps in diagnosis, prognosis, and treatment selection by clinician, as the abnormalities could be categorized according to the severity and selective treatment. There is no comprehensive data on cytogenetic abnormalities pattern of MM patient in Malaysia. Thus, this study aimed to identify the gender, the type of cytogenetic abnormalities, prognosis, and the association between abnormalities and the prognosis of the disease in Malaysia. Let's take a look at the result. First is to identify the gender of the patient, and the prevalence of the study shows that the finding of the study shows that the prevalence of male is higher compared to female, about 56.5%. And next one is to identify the abnormalities by karyotyping, and we found that the prevalence of hyperdiploid, about 62.5%, is highest among other abnormalities that occur. And Yi et al. Stated that hyperdiploid is one of the common abnormalities occur in MM, and also it can lead to good prognosis. And next one is to identify the abnormalities by FISH analysis, which is the common abnormalities occur as chromosomal gain, and we can see that chromosomal gain at centromere 9 and 15 have the highest number of cases, about 28.6% among other abnormalities. And the abnormalities obtained from the test categorized according to its prognosis, according to the IMWG, International Myeloma Working Group, and the previous studies that categorized the same abnormalities. So this study categorized gain centromere 9 and centromere 15 as the abnormalities that have bad prognosis due to its effect on the cell, as a study shows that overexpression of centromere protein can lead to cytogenetic abnormalities and cause cell death. And the last one is to find the association between these abnormalities and the prognosis, and we found that both cytogenetic abnormalities from FISH and karyotyping are significantly associated with the prognosis. So in conclusion, the hyperdiploid and gain chromosomal abnormalities are common cytogenetic abnormalities occur in Malaysia, and also cytogenetic abnormalities also as significantly associated with the prognosis, and the finding helps in the future intervention of managing treatment selection, and also enhance the understanding of cytogenetic abnormalities that occur in Malaysia. Thank you.